Hey, it's Birdman for Summit Healthcare's, and we're hanging out here in the studio. I've got with me Ken Allen. How are you, sir?
I'm doing very well. How about you?
Give everybody your title once again.
I am the Chief of Physician Services for Summit Healthcare.
Okay, so you guys are a little busy right now.
I'm quite busy.
And ramped and kind of in the getting prepared mode as well, right?
Yeah, I think we're probably more in the getting prepared mode. And, people are taking the social distancing, to heart. And because of that, actually, some of our volumes are on the downside.
That's good.
People are staying at home. And one of the things that we're doing, and I think one of the things we'll talk about today, is ways that we can ensure people continue to get access to healthcare, yet reduce exposure to the COVID virus.
Yeah, and that's been a major concern. I mean, the big major concern is the fact that if you had a whole bunch of COVID patients come in, it sort of displaces anybody else being able to have any issues like heart attacks, strokes, things like that. But you also don't want just daily care to stop.
Correct.
Okay, now they've stopped elective surgeries. Those are kind of things that you can put off.
Right.
But daily care, that kind of stuff still needs to keep going. So how are people going to do that?
So, people still have the need to receive primary care. We have people that have chronic care conditions that are going to continue to need treatment. One of the things that we're seeing with the COVID virus is those people that have multiple medical conditions or comorbidities actually have a higher mortality rate. So it's important that we keep those risk factors or those clinical parameters under control. And so one of the things that we're doing a lot of different things, but in all of them have basically the same two functions. One of those is to reduce exposure both to patients as well as our providers. The other is to make sure and ensure people have access to medical care. And so from the access to medical care side, we've split all of our providers and their support staff into two groups. We've now opened up all of our clinics Sunday through Sunday, 7 days a week, 12 hours a day. That helps to ensure people can get access to care. And then the other thing is we've recently started doing a lot of telemedicine visits. And so telemedicine visits are an encounter that you can have with your provider. It can be on your smartphone or a tablet or a computer, anywhere where you can have a visual transmission or visual telecommunications.
Okay.
And there's a very good purpose for that. One is we can make sure people get access to care, at the same time reducing exposure for the health staff to a potential infected individual, or from one of our healthcare providers to a potential patient. And the limitations to that is that, one of the arts of medicine is, the providers being able to lay the hands on the patient and to touch, feel, hear. And so you lose some of those sensory inputs, but it does serve a very good purpose in that we can do checkups on individuals, we can do medication refills, we can do some preventive measures, and so it has a very good place for it. The other things that we're doing in our clinics to reduce exposure is we are now testing patients as they come in. So we test them at the door, we test temperature, we look at oxygen saturations. We're assessing whether they have a new onset cough, new onset shortness of breath, or worsening of those, loss of taste and smell, GI disturbances, whether they've left the area recently or had somebody come in from an area where it's widespread. And so we're doing those things. The other things that we're doing is we've basically removed all of our waiting rooms. Patients are waiting out in their cars, and then we have a system set up to where we can notify them, and then they come in and we take them directly to an exam room. So trying to reduce exposure all the way around.
Okay, so between telemedicine and then, of course, the advanced precautions going on there, it's going to be as much as possible to be able to provide in the circumstances. And it all comes down to risk assessment, doesn't it? You're going to have to put some risk to be able to help people. So it's good that people recognize that maybe.
Yeah, we're taking all the precautions precautions, all the necessary precautions. So we have all of our staff now, we have them in the cloth masks. If we have somebody that comes in with very presumptive symptoms, then we go to the N95 masks and some of the protective garb. And when we have those situations, we try and clear patients away, put those patients in those rooms, and then do a real good clean after they've left.
Yeah, and I don't know if you can speak to the mask thing, because there's been some people talking about the masks, and they're like, well, just putting over a bandana over your face, it's not like an N95 or anything.
Correct.
Of course it isn't, but it's all any flow that you restrict or slow down is just another layer of precaution, and that's why the CDC said, hey, if you're going to go out in mask, go out, wear a cloth or t-shirt material, something like that.
Right.
Because it's just another layer of protection versus just direct contact.
Yeah, I mean, there's a ton of information out there right now. And they say that the cloth mask, about 60% protection, which is better than none. What we're really trying to do with all of this is we're trying to preserve the most intensive equipment for those most intense patient situations. So.
Okay. Anything else that we need to cover? We covered the outpatient pavilion.
Sure.
We covered the telemedicine. Anything else?
Yeah, I'm really excited. One of the concerns that I think we read a lot about in the media is the availability of tests. And so just recently, late last week, we were able to work with one of our specialty labs, and they're going to be providing a substantial increase in the number of tests available to us in the White Mountains. I think right now we haven't been doing a lot of tests because we don't have the availability of a lot of test kits. So on any given day, we have probably 3 to 5 kits available to us, and then we're talking about going into the hundreds. So it's going to be very substantial increase. Now there is criteria that we use for testing. Number one, do we have a healthcare provider that has been exposed? We look at public safety, law enforcement, fire, to see if they've had any types of exposure. We look at individuals that work in critical infrastructure, waters, gas, electricity, telecommunications. We look at people that live in congregated living situations. We look at individuals that have symptoms. So we're not going to test with no symptoms. So we're looking for people that have temperatures of 100.4 or greater.
Right.
We're looking for new onset, shortness of breath.
So even early on, when Denver was talking about they were doing tests and stuff, you got to remember there's millions of people there.
Right.
They were limiting it to 100, and they had to have those criteria to be tested.
They have to have those
That's
criteria.
why that was going on.
And so, we've contemplated actually opening up a drive-through testing, and we actually thought against that. And so what we decided to do is we're going to farm out all those tests to all of our primary care offices, put them in our emergency room, and then start testing those presenting populations first.
Good. Well, thank you very much for your time. Appreciate
Absolutely, my
it. And
pleasure.
thank you for what you're doing there at the hospital.
Thank you.
Hey, that's going to be it for this episode of Summit Healthcare's. Remember, you can check summithealthcare.net to find out all the information you need, their Facebook and Instagram as well. As I always say in this show, and kind of means more now, wash your hands, stay healthy.